For the rest of this section, I'll be going over extracellular matrix proteins, which give tissue their structure. Collagen is the most abundant protein in the body, and it's made of 3 helical proteins that form a triple helix. There are 4 main types of collagen, which are different in the structures of the alpha helices that make up the triple helix. Each alpha chain can range from 600 to 3,000 amino acids, and the triple helices can be homotrimeric, which means they contain 3 identical alpha helices, or heterotrimeric, which means they have 3 different alpha chains. Type 1 collagen is the most abundant and is found in bone, skin, tendon, dentin, fascia, and the cornea, and is also involved in wound repair. Type 2 collagen is found in cartilage, the vitreous body, and the nucleus pulposus. For type 1, it's most important to remember that it's involved in bone, and you can remember this since the word bone has the word 1 in it. Similarly, type 2 is most important for its role in cartilage, which you can remember using the word cartilage. Alright, type 3 collagen is also known as reticulin and is found in the skin, blood vessels, the uterus, fetal tissue, and granulation tissue. And lastly, type 4 collagen is found in the basement membranes or the basal lamina, which you can remember using the mnemonic type floor under the floor. Can you think of some places in the body where basement membranes are found? Important ones are the glomeruli of the kidney and the capsule of the lens. We'll talk more about that in a minute when we go through some associated diseases in more detail.
Most collagen synthesis takes place in cells called fibroblasts, which you can recognize by their spiky shape like the ones you see here. Let's take a look inside the fibroblast and go through the steps that lead to the final collagen molecule. Protein synthesis, hydroxylation, and glycosylation all take place inside the cell, and proteolytic processing and cross-linking takes place outside the cell. For the step 1, it's important to know a few things: which steps take place in which subcellular compartments, the particular amino acids that are most common, and how they're modified. So you might have a question stem that describes a kid with a defect in collagen synthesis, and then they ask you, what's the most common amino acid in the protein that's defective? Do you know what that would be? The most common amino acid in collagen is glycine, and by the way, proline and lysine are the other 2 amino acids you should associate with collagen, since these are the sites of important post-translational modifications. So since this is a protein that will end up outside the cell, is it synthesized in ribosomes on the rough endoplasmic reticulum, or ribosomes floating around in the cytoplasm? That would be the rough ER ribosomes. So the first thing we'll make is the pre-pro collagen alpha chain, and then hydroxylation and glycosylation both take place in the ER. So here's another question you can get in your exam. Someone who's been sailing around the world and had limited access to fruits now has knee pain and bleeding gums. What step of collagen synthesis is not working properly? Well, this is a classic case of scurvy, or vitamin C deficiency, in which defective collagen makes you bleed, especially from your gums and also in your joints, which can cause joint pain. And which step in collagen synthesis requires vitamin C? Hydroxylation. Enzymes will hydroxylate prolines and lysines, and these hydroxyl groups will be used at the end of the whole process to link triple collagen fibers together, though I'll get back to that in a minute. The other modification in the ER is glycosylation, in which either a single glucose or galactose molecule is added, and this is only done in lysines. So why do you need to glycosylate your pre-pro collagen? Because these sugars allow the molecules to stick together to form procollagen and form a triple helix. And they're also held together by hydrogen bonds and disulfide cross bridges. A mutation that disrupts glycosylation and therefore prevents the triple helix from forming can cause osteogenesis imperfecta, which we'll talk about more in the next slide. Procollagen is then transported from the ER to the Golgi, and does that step require COP1 or COP2? That would be COP2, which is for anterograde transport. What happens to collagen once it's in the Golgi? Actually, not much happens in the Golgi at all. It's just used to transport the molecule out of the cell. So after exocytosis, procollagen is cleaved at both ends to make tropocollagen. It's cleaved at lysines in disulfide-rich regions of the protein, and then individual tropocollagen molecules are covalently bound together between lysines and hydroxylysines, which is catalyzed by the enzyme lysyl oxidase. What ion does lysyl oxidase need to be able to function? That would be copper, and by the way, lysyl oxidase is also needed to make elastin. This results in the final product, collagen fibrils. A deficiency in this last step is one of the important causes of Ehlers-Danlos syndrome, which I'll go over in a couple slides.
Osteogenesis imperfecta is one of the most common deficiencies in collagen synthesis, occurring in about 1 in 10,000 people. Therefore, it's also the most commonly tested. This is also called brittle bone disease, since it prevents the synthesis of type 1 collagen, which is a key component of bones. Since there are several different genes involved in collagen synthesis, there are a variety of genetic defects that can result in osteogenesis imperfecta. The most common viable form is autosomal dominant. Patients with OI can present with multiple bone fractures without a history of trauma, including during birth. This is often confused with child abuse, and you may have to differentiate between the two on your exam. Patients may also have blue sclera, since the connective tissue over the choroidal veins is more transparent, allowing the blue veins to be visible, which you can see in this image. Since the middle ear bones are required for hearing, patients may have hearing loss as well, since those bones don't form properly. Lastly, patients have dental imperfections, since they can't synthesize dentin properly. And here's the last flash quiz for this section. What type of collagen is found in the basement membrane? Remember, type 4 under the floor, so type 4 is in the basement membrane. Collagen defects can also cause Ehlers-Danlos syndrome. There are several types of Ehlers-Danlos syndrome, all of which involve hyperextensible skin, which you can see in this image. The most common type is also known for having hypermobile joints, which you can see here. Some other types you should be aware of are the classical type, which is from a defect in type 5 collagen and also comes with joint and skin symptoms, and the vascular type, which can come with easy bleeding or bruising, but also the more dangerous issue of berry aneurysms and organ rupture. This one is typically caused by a defect in type 3 collagen. Depending on the specific mutation, these can be either autosomal dominant or recessive. I wouldn't worry too much about the genetics or the type of collagen for Ehlers-Danlos, since there are so many different types with different etiologies. But you should be familiar enough with the symptoms that if you see hyperextensible skin in a question, and they're asking you what type of vascular pathology you should be concerned about, think of berry aneurysms. Next, we have Menkes disease, which kind of indirectly affects collagen. Menkes disease is caused by a defective gene called ATP7A on the X chromosome, so this is an X-linked recessive disease, and it's extremely rare, only affecting about 2 or 3 people out of a million. This gene codes for an ATP-dependent copper transporter, which is found in most tissues including the small intestine, where it helps absorb copper from the diet. So ultimately, this will look kind of like copper deficiency, and enzymes that require copper won't be able to work very well. So what's the enzyme in collagen synthesis that requires copper? I'll give you a hint. It's used to cross-link triple collagen triple helixes to make collagen fibrils. This would be lysyl oxidase, and this is why a defect in a copper transporting protein causes collagen deficiency. The first signs and symptoms will be soon after birth, and you might see seizures, weak muscle tone, growth retardation, and blue sclera, like in osteogenesis imperfecta, and later you'll see intellectual disability and what is often described as kinky hair, although I would describe it as kind of a sparse and fuzzy-looking hair. You can actually treat this by injecting copper into the patient, although that only partially helps. Since this has an onset during infancy, it's important that you diagnose it and start treating as soon as possible to prevent the developmental problems. And the last thing to cover in the cellular section of biochem is elastin. As its name suggests, elastin is an elastic protein, and is found in anything that needs to be stretchy, like the skin, lungs, large arteries, elastic ligaments, and vocal cords. It's kind of similar to collagen in that they're both rich in proline and glycine, but it does not have hydroxyproline or hydroxylysine. It's also similar to collagen in that elastin is primarily produced by fibroblasts. So how is elastin made? Well, tropoelastin is secreted by fibroblasts and then cross-linked to other tropoelastin molecules along a scaffolding of fibrillin. It's the cross-linking of tropoelastin molecules that gives elastin its elastic properties. So what happens if you have a defective fibrillin gene? This is actually the cause of Marfan syndrome, which affects about 1 in 5,000 people. We'll come back to this later, but it results in bone elongation, arachnodactyly, hypermobile joints, lens dislocation, cardiac abnormalities, and aortic rupture. The most common cause of death from Marfan's is an aortic dissection, caused by cystic degeneration of the aorta, which you can see in this image. Now normally, elastin is broken down by the enzyme elastase. To prevent elastase from breaking down too much elastin, the protein alpha-1 antitrypsin inhibits elastase, thus preserving elastin. If a patient has a deficiency in alpha-1 antitrypsin, elastase becomes overactive and destroys elastin. This is often due to a lack of alpha-1 antitrypsin secretion from the liver, where its accumulation can cause cirrhosis. This also creates problem in the alveoli of the lung, where lack of elastin results in emphysema, especially in patients who smoke cigarettes, since cigarette smoke also inhibits alpha-1 antitrypsin. In this image, you can see normal alveoli on the right and alveoli damaged by elastase on the left, which is what emphysema looks like. A common treatment of alpha-1 antitrypsin deficiency is intravenous infusion of alpha-1 antitrypsin, and interestingly, this also helps patients who have emphysema from smoking. Alright, let's go through a couple questions before moving on to the next section. We'll start with this one. A young father brings his 16-month-old son to the emergency department for the third time in 6 months. The toddler has a non-healing wound in his right knee that originated after a fall 10 days ago. According to the father, the previous clinical visits also resulted from falls in which the child incurred multiple broken bones in his wrist and tibia. Physical examination reveals blue sclera and an abnormal posture. It is noted that the child does not react to conversation. Which of the following is the underlying factor in this child's diagnosis? So go ahead and pause the video if you want some time to think about this. Okay, so what's going on here? Well, you've got a kid who is repeatedly breaking bones, which can either mean one of two things. He's being abused, or his bones are easily breakable. The giveaway here is the blue sclera, which you would not see in child abuse, but you do see in a certain disease that makes you prone to breaking bones. In fact, it has the nickname brittle bone disease. So the answer here is choice D, a defect in type 1 collagen, which is osteogenesis imperfecta. Remember, type 1 collagen is the type you should associate with bones. And by the way, how does the child not responding to conversation tie into this? Well, remember, there are bones in your ears that you need to hear, so this is in reference to the hearing deficiency that comes with osteogenesis imperfecta. Okay, let's do one more question before moving on. So, a 53-year-old man presents to a clinic for the first time. He has not seen a doctor in years until a few months ago, when he presented to the emergency department with severe headaches and underwent life-saving brain surgery. On examination, you notice he has flexible joints and compliant skin, as well as an abundance of bruises all over his body. When asked, he says these things run in the family, but have never caused him any problem. What defect is most likely contributing to this patient's disease process? So again, you can go ahead and pause the video if you want to think about this. Okay, so this guy has hyperextensible skin and hypermobile joints. That narrows it down really quickly to Ehlers-Danlos syndrome, which is caused by a defect in what? Well, that's actually a tricky one because there's a lot of different types of Ehlers-Danlos caused by defects in different types of collagen. So now we need another clue from the question, which is his life-saving brain surgery. Why would someone with Ehlers-Danlos need brain surgery to save their life? A berry aneurysm, which you're going to see in the vascular type, and this is caused by a defect in collagen type 3. So now, another noteworthy guess would be that he had Marfan syndrome, which is a defect in fibrillin, because that also comes with hypermobile joints and berry aneurysms, but you wouldn't see hyperextensible skin with Marfan, and they would also probably give some more Marfan-specific signs, like tall and thin with long, thin fingers.